Okay, good afternoon and welcome to today's presentation in our Collegiate Recovery webinar. My name is Olivia Pennelle and I'll be your host today. We're joined by Keith Murphy of Rutgers, Matt Statement of the University of Michigan, Jess Estok of the University of Delaware, Kristine De Jesus from Montclair, and the topic of today's presentation is Collegiate Recovery and Mental Health, a CRP discussion. And we are going to start by telling you a few logistical items so that you know what's happening. In order to support the growth and development of the collegiate recovery field, we are hosting these webinars, and just a few reminders before we turn things over to the panel. Today's webinar will be recorded and uploaded to YouTube and the ARHE website. You'll be able to go back and access all the information at that time. If you have any questions for our presenter, there's a Q&A box at the bottom of the screen. Enter any questions there and me or Mesa will get back to you and we'll answer as many questions as we can in the time that we have. If there are any supplemental materials, we'll send them out to you after the webinar. If you have any technical difficulties or any logistical questions, just let us know. Feel free to message us through the chat box and direct the message to all panelists if you can. We're always looking for ways to improve, topics to cover, and any other feedback from our attendees. So please feel free to reach out at any time and let us know about your experience today. So as we have a panel rather than a one-on-one webinar today, we're going to start by everyone introducing themselves a little bit more. So let's go through and give everyone our names, pronouns, and your roles at respective institutions. Kristine, do you want to go first?
Absolutely. My name is Kristine De Jesus. I am a staff psychologist and the coordinator of the Alcohol and Other Drugs program at Montclair State University. I support our students in recovery in addition to doing clinical work. Was that everything you asked for?
You gave me your pronouns.
Oh, she, they. I'm sorry, they're not showing up on here. They are she, they.
Thank you. Jess?
Hi, everyone. My name is Jess Estok. I use she, her pronouns. I'm at the University of Delaware, and I'm Assistant Director for Substance Use Recovery Services.
Keith?
Oh, hello. My name is Keith Murphy. I use he, him, his pronouns, and I am the recovery counselor at Rutgers University, which essentially means I help manage the day-to-day operations of the Rutgers Recovery House.
Thank you. And Matt?
Good afternoon. My name is Matt Statman. I use he, him pronouns. I manage the Collegiate Recovery program at the University of Michigan.
Thanks, everyone. So why don't we kick off by talking about what the greatest challenges are that face students in collegiate recovery? Who wants to go first? Should we go in order? Jess, not to put you on the spot.
Sure. So in reflecting on that question, I'm thinking like current challenges, right? Because my mind, like probably everybody's mind, is around COVID and the pandemic. And I think the greatest challenge right now is just that isolation, right? So I think being physically in a room with somebody is a lot different than being in a virtual room with somebody. You just kind of can't get the same vibe, that same connection, can't hug them, can't shake their hand. So at least for the students that I've been working with, that isolation has been pretty triggering and a big struggle for them. I don't know, has anybody else experienced that with their students?
Yeah, this is Keith. You know, for the most part, the primary focus of Rutgers has been with the students that are in the recovery house. So fortunately, a few have been allowed to stay on campus because obviously home may not be a good place to go to, or they may not have a home and this is their primary residence. But still, it's the same. It's the idea of isolation, not being able to connect with outside folks, and then having a really hard time adapting to what's going on. I mean, like everyone, you know, I really think of Amy Boyd Austin. This is like one of those times where we just have to take off our professional hats and just be humans in this whole space, because we're really just absolutely all going through trying to connect with folks in the right way, trying to really develop and have lasting relationships, and also trying to be safe and not trying to kill ourselves and those that we love with COVID, because it's real. And I've got older people in my life. Students have older people in their life, and what's harm reduction in terms of what they're doing in terms of COVID, and really dealing with universities and systems that are not doing the best job of protecting them and really looking out for the bottom line or the dollar. So that's what I see that they're dealing with today. In addition to all the social unrest and upheaval and trying to navigate those spaces and all the identity issues that come up, and go to school, online and so on and so forth. So.
Yeah, if I can add to that. So I don't know if other folks are experiencing this, but for our students in recovery and the general students who are presenting for counseling services, this expectation that they're placing on themselves that they should be able to function and be productive as normal. And the pressures that they're putting on themselves and the stigma that they experience that's internalized by being a person in recovery, and that they're somehow defective. I have to constantly remind students, like, we're all in survival mode. We're trying to survive a pandemic, and to expect normal levels of production is unreasonable and unhealthy. But really having that discourse with them and helping deprogram some of that information that they've learned about being productive and being of service, and how if you're not doing that, your recovery isn't right. So that's one of those big things that I keep seeing and repeating, sort of feels like on the daily with my students, right? That it's okay to not function the way you're told you should function, and really normalizing that for them, because there is so much shame and stigma around that. And it's a common experience, but I don't think our students in recovery recognize that other students are experiencing that as well. I think they think it's a unique, experience for them. And it's like, no, this is a global experience right now. We're all struggling with that. So really, creating an opportunity to normalize the trauma that we're all collectively experiencing and processing that.
Yeah, I concur with all of what's been said. I think the isolation and the pandemic sort of magnify all of the challenges that the students would normally be having in a fall semester. So certainly the isolation is difficult, although I also think that a lot of the students in recovery are really well situated to deal with this. They already have a lot of social support. They adapted early on to getting social support remotely. And so I think there are some protective factors about being in recovery at a time like this. I was talking to a student yesterday who said this whole semester feels like one big long midterm. And the academic pressure it might be harder now. I'm not in an academic unit, I'm not teaching, but the sense I get from the students is that there hasn't been a lot of grace on that end, and that in some ways, some of the professors may even be piling on a little bit more because they don't have a lot of experience teaching remotely. So the students feel like they are being bombarded academically in maybe ways that are unique and harder than a normal semester. There certainly are learning issues for some people that are really stressful. They don't feel like they can go talk to an advisor or seek, tutoring or help on the side. Or, I've had students say, I'm used to being able to stay after class and ask questions. And now, there's 100 people on a Zoom and there is no staying after class. So those kinds of pressures. And then, just how do we have fun? How do we have fun when we're sitting in our houses 24/7?
Thank you. So Kristine, you wanted to add?
Yeah, I was just wanted to say, agree with Matt, like that ability to connect socially is such a struggle, I think. And I think some schools are doing a better job at making sure those social needs are met. But I think that connection via Zoom or whatever online medium we're using isn't the same. And I think while our students are incredibly resilient and have done a fantastic job at acclimating to the challenges, it's been really hard to provide social supports that feel adequate during this time for them.
Yeah, and I just want to add that just as Matt was saying, we're experiencing the same thing where professors just seem to be piling on and have increased their expectations of our students and really aren't understanding that, as Kristine said, this is trauma. We are experiencing this global trauma, and our levels of productivity and expectations around that need to be lowered just a little bit, and we need to give ourselves some kindness and some grace around that. So our students are experiencing the same thing. So there is a lot of reminding them to do what they can to be kind to themselves, do what they can to slow down, do what they can to take care of themselves.
Yeah, and I think it's such an important point of like the need to pull back expectations, you know, and I think we also need to be really mindful that our students are not monolithic. Our students are dealing with multiple traumas simultaneously. You know, when we talk about what's happening in the world, it's not just a pandemic. You know, the United States is really experiencing a lot of issues related to race and class, and at least my school, I work in a minority serving institution, and our students are personally impacted by it and by the pandemic in different ways. And so we have these, you know, these negotiations that we're really trying to help our students navigate, which is often, at my school at least, our professors are primarily Euro-American and coming from a really different background than many of our students. And there's not opportunities to talk about how people are struggling differently and experiencing things differently, and creating that space to really understand that our students aren't just surviving a pandemic. They're going home and taking care of loved ones who are experiencing trauma related to the pandemic. They're watching people who look like them being murdered on television. And so there's all these different experiences, you know, they're going on social media and being bombarded with information. And so I think, you know, we need to be mindful that our students in recovery aren't monolithic. They have many lived experiences. And that if we're not creating some space on our campuses to address those issues, then we're not really serving them adequately. And I think there's not a lot of discussion, at least on my campus. I don't know if it's different on other campuses, but I don't think that there's a discourse happening about how the pandemic and how life right now is playing out differently for our students in recovery and for our the different cohorts of students in recovery on our campuses.
Yeah, I can't help but to think that too, that the idea of a campus doesn't quite exist in the same way as it used to. It's more of a metaphor as opposed to an actual physical space. And for a lot of students, that really means a lot of different things and a lot of different losses. And I think probably if I were to actually sum it up, what the greatest challenge now is for students really dealing with grief and loss and really trying to navigate that, because it's perpetual grief and loss. It's this perpetual thing of like adjusting, readjusting, getting used to one thing and then having things really shift and then just getting used to another thing. And then that ties to, you know, anxiety about the future. And I can think of like food insecurity. I can also think of financial insecurity. Well, is this going to be my last semester? Because all of our institutions, in some way, size, shape, form, or fashion, not unless we have a massive endowment, and I'm looking at all of us representing maybe state schools here, we don't have massive endowments that can really absorb the big hit that we're going to take in terms of COVID. So the anxiety level is present in terms of staff. It's present in terms of, you know, the educators providing material because they're maybe performing for their jobs, and they also professors don't want to lose the idea that they're delivering a service that's just, or education that's just not of the same quality, of the same caliber. So, you know, students are really caught in the middle of this perfect storm of just like not knowing about the future, but being really compacted and really pressed about their present. So, and then just, you know, things used to seem kind of linear, you know, college, maybe job, maybe find your own place. Now, God forbid, like if I've got students who are looking to graduate in December or January, what are you graduating into? What am I looking at in the spring? And I guess the greatest challenge is just that absolute uncertainty that's just there. You're just literally literally just walking through a fog. And I think that's the global sense that I am experiencing, and I think that's what they're experiencing too.
Yeah, I'm curious to my other panelists too. Like, are you all, I know on my campus, there's a lot of talk and confusion and angst also around the current political climate. And so it's just one more level. And I hear them this week talking about their appointments next week and how they're going to be coping. And I'm just curious for my other panelists, are you having those same experiences?
We are, and there are certain departments within student life that are setting up supports for next week. So there are events that are occurring on Wednesday that are providing space, or will be providing space, virtual space for students to come together and talk about their experiences and talk about what's going on with them. So I do appreciate that our campus, our university, is being so proactive with certain things. Same thing regarding all of the tension around race as well. The counseling center has developed a therapy group or a support group around it. We have student of color drop-in hours. So I really do feel like there are departments at UD that are taking that proactive stance, which is helpful. It's challenging because it's all in that virtual world. And I think students can be so screened out that they're missing some opportunities, of course. But I see that in myself as well. When I don't have to be somewhere on a screen, if it's at the end of the day, I'm going to take that time for myself and really reclaim that.
Matt, sure.
Yeah, I echo all of what has been said, and our university is doing some of that work to support students, the broader population, and I've been having individual conversations and group conversations with the students in recovery around sort of what are your expectations for next week? How are you coping? How are you going to cope, leading up to it and after it? And, I think Keith's point about the sort of everything being unknown, the expectation that we're going to know who even won the election next week is probably one that we need to take a look at. So just continuing to have those conversations with students, I think, is important.
And I'll even add in terms of the election stuff, is just like, even if there is if there's an outcome where one person is picked, that doesn't mean that those other groups have gone away. There's still the presence of those conversations, and those folks, for good or for ill, are going to be active in terms of what they're voicing their displeasure. And that's going to be a long time process. Probably, I mean, for as long as COVID will be around, the effects of this election will be with us and be present. And it'll be different for different students as well, because God only knows what their families are like, what the climate is going to be like if they go back to school in the spring. What does that mean in terms of, again, is there going to be stimulus for folks? Can they come back to school? So it's all of the stuff that just keeps happening, whether we wanted to or not.
We've also had a few students who just elect not to take classes right now, and they made the decision in August that I'm not paying to do this remotely. And we're still engaging with them, but they are going to be faced with that same decision in January. And who knows if they're going to be faced with that same decision next August at this point. So, we can continue to support them, fortunately, but, we have several students who are not currently enrolled, and we support those decisions.
Thank you. Kristine, did you want to add something before I move on? No? Okay. Now this is a really good segue into, which we kind of touched on slightly, this question. Let's talk about the best practices that you've observed in supporting mental health. Who wants to go first? Keith, you're smiling. You go first.
I was smiling to hide, but, but I was like, maybe I could find a space in the Zoom where I could just crawl up into a corner. I mean, it's such a, oof. I mean, I don't even know where to start, to be honest. So let me just sit back for a minute. Let me process it. But
Sure.
because it's such an expansive question. Go ahead.
Matt?
I'm happy to get the ball rolling.
Sure.
The students who I work with are students who are in recovery from substance use disorders. There's a high prevalence of co-occurring mental health stuff in our group of students always. A couple of things that just come to mind off the top of my head. And the first is having those conversations. So, they don't just have one area in their lives, they are whole people. And it's important to be able to normalize conversations about mental health, about medications, about therapy appointments, about, seasonal affective stuff, all that kind of stuff, so that those conversations are comfortable for students to have, or as comfortable as possible, or as normal as possible. Talking to them about how to communicate about their substance use recovery with their the people who are prescribing for them, or the people who they're seeing for therapy. So making sure that they know to talk to their healthcare professionals about what their recovery looks like, what they do for their recovery, and maybe preparing in advance for potential difficult times where a medication that could be problematic might be offered to them. And so just making sure that their providers are recovery allies, rather than sort of a place where they might go and have their recovery threatened or harmed. And then just having lots of resources on and off campus for students who need them. So I'm not clinical at my job. And so I need to know where they can get clinical help and what the barriers to that help might be, and where different, who takes Medicaid, who takes private insurance, who does sliding scale, where are all the providers and off campus, how do you get in touch with CAPS? What's appropriate to refer to CAPS and what would be better referred off campus, that kind of thing.
Yeah, I just really want to echo what Matt had said, knowing the resources around campus, or on campus and off campus, near campus, is so important. So for us, I know that through my work with my recovery community, I've connected with the counseling center in a different way. So our collegiate recovery community is a part of student wellness and health promotion, and we do have supportive counseling services through student wellness. So that's kind of one resource that we have. But then also meeting with the counseling center and making sure that they know what resources we have through student wellness, through the CRC, and also knowing which persons at the counseling center might be more familiar with substance use disorders. So I can say, hey, go meet with Beth, she's awesome, rather than making that cold referral. And then doing the same thing for off-campus providers. So going out and having conversations with local therapists or local treatment centers, so that way I can make that warm handoff, and really kind of talk about the expectations of, once a student goes there, this is what it looks like, this is what you can expect, this is what your experience might be like. So that way it kind of eases some of their anxiety around that. But also kind of staying within my scope of practice, right? So I do have a clinical background, but my clinical background is not in, for example, eating disorders. We've seen an increase in students seeking support around eating disorders. And although there is a lot of overlap and a lot of similarity with recovery from substance use, there are key differences. And I know my limitations. So I feel like a best practice is knowing my limitations and then establishing the appropriate resources that I can then refer to. So that way I'm not doing any harm to the student or doing any damage to the student.
So thank you both for, essentially our program is based out of the counseling center. So our counseling center, CAPS, is up and functioning as normal, as regular, except not, because everyone is working from home remotely. We've got a couple of clinicians in-house that are actually in the building for drop-ins or emergency situations. Nevertheless, the thing that I've really picked up now in terms of really the mental health thing is not only knowing the stuff that's on campus and in state, but actually having to know stuff out of state. And I think that's the bigger thing, because in going to Jess's point of counseling, you know, your scope of practice, it means literally the limits within your state. I'm licensed in New Jersey to practice. However, if I've got students that are in Pennsylvania or New York or Ohio, there's nothing that I can do. So that's still for us to really find out proper referrals, what types of insurance do they have, to Matt's point, and then what changes does that mean in terms of what we can provide? Can we still even do case management with certain students, or does that fall into the realm of counseling? And thank goodness, you know, the federal government was flexible in the time of COVID to kind of to loosen some of the restrictions on, you know, doing what we're doing now, like Zoom or telehealth, as a part to continue to reach folks. But still, there are barriers. People who, one, are they at home with folks that aren't safe? Can they find a space to actually go out and talk? Do they have a computer in which to do face-to-face stuff? Are they operating from their phones? Are you using a platform that can be supported by their mobile device? You know, it's all of these things that came up as a result of us doing this work. And at the same time, you know, now a lot of our psychiatrists and have kind of been what used to be, you know, the more stringent in terms of just having, you know, a student needs to have X, Y, and Z before they showed up. Now they're like, well, I can continue to prescribe. We can still do meetings, you know, face to face, which has been over telehealth, which has been a good thing. So I guess ultimately, really just in terms of mental health for our students, not much has changed. The only thing that's changed is where they are in terms of their location. Because now when I start sessions, are you in a safe and secure location to share? Have you had any thoughts to harm yourself or anyone else? Who do I need to get in touch with if there's a moment of crisis right now? Blocking calls, like, you know, because you can't have my number if I'm calling you. So it's all of these things. Are we HIPAA compliant, like through telehealth? It's all of these things that need to be in place. And then it's another layer for students who, before the counseling center was readily accessible, they could just show up. And if they needed help and support, now it's maybe a phone call. Maybe it's now being routed to someone else. And so I feel like I'm the one that's coming in with more problems, but it's, again, everything has created an additional barrier for students to receive care. Nevertheless, we've been able to provide pretty continuous care. If anything, our numbers have dropped because students are at home and maybe they're okay on some level, but our numbers aren't the same. So.
Oh, and I can say that while I join you in all of those troubles, Keith, because there's a lot to manage when we're doing therapy remotely, our numbers have dramatically increased, particularly with our students in recovery. I don't know if we're just doing a better job of reaching them or they feel safer to ask for help via via Zoom or access, because so many of our students, we're a state school, are working. And so now they can fit a session in versus having to come to campus and be seen. But the complications are there. And I think one of the things also that, and I don't know if you can speak to, any of you can speak to this too as well, but making referrals to other departments on campus seems to be one of those really important things right now. So getting our students hooked up with our food pantry, because food insecurity has been a profoundly wild thing, particularly for our graduate students. And I'm not sure why, particularly for the graduate students, but our graduate students seem to have been hit harder with food insecurity. The referrals over to our Disability Resource Center and getting accommodations for our students and making sure we can get those over in a confidential way. These things we were doing before for our students, but I think in the times of COVID, the needs are just greater for our students on my campus. And so really needing to think about what services we have and how those best practices are going to be there for them, and utilizing them in ways we haven't utilized before. I feel like I'm on first name basis with the Dean of Students right now, and lots of calls and emails back and forth, just, again, advocating and negotiating, lots of releases of information being signed where historically our students didn't feel so safe asking for those accommodations or outing themselves. I find that they're really outing themselves as being in recovery at a far higher rate than I've ever seen them do. And talking about being real, I don't know if you hear my children stomping in the back. I apologize, but this is COVID. Welcome.
Thank you. Does anyone want to add anything to that question, or should we move on to the next one? Okay. So the next question we have is, what does the field need to know about the intersection of collegiate recovery and mental health? What does the field need to know about the intersection of collegiate recovery and mental health?
I think to Kristine's point, collegiate recovery is not monolithic at all. It is not the same group of folks who are accessing services. They're as broad and as wide and as deep as people who are seeking recovery. I think that's a fair thing to say. And it's always interesting to me when people talk about students, and I'm like, well, what type of student are you talking about? Because students come to school, especially higher ed, at different times of their life, different stages of their recovery, with completely different understandings and need different levels of support. So if you've seen one collegiate recovery student, you've seen exactly one collegiate recovery student. So that's.
Yeah, and I think we need to be thinking about when we're talking about therapy and mental health and the needs of our collegiate recovery students, I think we need to be really mindful about the intersectional identities that people bring forth, right? So like Keith was bringing up, when you've seen one student, you've seen one student. So many of our students, I'm going to speak from my experience in terms of students who use a 12-step recovery. So often they're afraid to bring different parts of themselves into the therapy room. They feel like I can only talk about my recovery and I can't talk about my mental health. And so really talking and creating some space for what those intersections look like, right? What's impacting your mental health? What's going on with your mental health? What other areas of your life are impacting your recovery and your mental health, right? I think so often, and I'll speak for myself in my clinical training, it was very much, we just focus on what the diagnosis is, and we don't talk about other things that impact people's mental health. We don't talk about, we have all these codes, but I feel like we don't do a good job of talking about the complexities, the V codes, the other areas in life. And so really sitting down with the students and saying, okay, how is your, dating relationships? How are these other parts? How is racism or systemic oppression or, transmesia playing out in your life, right? So really talking about these intersections and how they're impacting their general well-being as well as their mental health, because we can't separate those two from another, and we can't separate one's recovery from their mental health. So having really complex conversations with students and inviting them to bring their whole selves into the room, I think is such an important piece of their mental health and really creating wellness for them in a way that, again, I think many people just haven't been engaged in that way for whatever reason, whether it's the training of the professional, the pathway to recovery, the fact that just people don't talk about feelings, let's be honest, right? Like we as a community, and I don't mean the recovery community, I mean the United States, we're not great at dealing with emotions in a meaningful way. And so being able to talk about these things that impact our mental health is so important. And I think for students in recovery, we really need to be concrete about talking about the impacts of mental health and all these other identities they have and what role they're playing in their functioning in the world.
Thank you. Does Matt?
Yeah, I like how you talked about them it being inseparable. And I think one of the coolest things about collegiate recovery, and one of the things that students frequently say, is that this is a space where I get to talk about my whole self. I'm not just, they go to a mutual aid meeting and it's the scope of what they can talk about is narrower, or at least they feel like it is. And so, having a place where they can come talk about their whole selves and all the different pieces of their identity and the ways in which, you know, they're going about being in the world and how that's affecting their recovery and their mental health, is something that's really cool about collegiate recovery. And I, you know, unfortunately, not as common in the broader community. So in a lot of ways, they're super privileged to be part of a collegiate recovery program.
I agree with everything that has been said. And I think just the key thing is that piece exists, right? So for anybody who's doing this work, like, to recognize just how common co-occurring disorders are, right? And I think those numbers grow even higher when we look at the collegiate recovery population. I think I've seen numbers as high as 80% of our students are experiencing co-occurring disorders. So knowing that it exists and then creating that brave space, right? So that way our students can talk about these things with each other and really allowing them to bring their whole person to the table is so important. I know currently, I think almost every student that is a part of our recovery community has another diagnosis, whether that's PTSD or bipolar or anxiety. Those appear to be the three that we see most commonly. And allowing them space so that way they can have discussions about what their experiences have been like, what it's like to adjust medications, what it's like to start coming off of medications, and kind of allowing them to have those conversations with each other has been, I think, so powerful for the students that I've worked with through our CRC. Yeah.
Thanks, Jess. And the last question I wanted to ask, or rather if we want to add to, is what can CRCs do to increase mental health awareness on their campuses?
I think one thing that's been really helpful for us is partnering with different departments on campus. So since we are not part of the counseling center, creating that partnership with the counseling center, and then also creating relationships with student organizations that have that as part of their mission. So organizations like Friends for Friends, Active Minds, so that way it can increase the visibility of the recovery community as well as that mental health piece as well. And then doing some awareness events together. So for example, the University of Delaware hosts a Fresh Check Day every year, and that's through the Jordan Porco Foundation. And that is something that is hosted on hundreds of campuses across the country. But that's a great way that the CRC has partnered with student centers on campus and with the counseling center and then with different student organizations. So anything that we can do to kind of promote those collaborations and then do those external events as well.
Thank you. Does anyone want to add any extra suggestions, Keith?
Yeah, I like what Jess said a lot. And honestly, this is sad, but my first thing is, well, nothing, because now hear what I'm saying, because a lot of that work falls on the students, you know, and oftentimes it's harder for students to really, because stigma is real, and the pain of coming out and really being that first person to really talk about mental health stuff is really, it's a tough thing of being that first person and trying to nurture a student to be able to be out and about what's actually going on. And it's hard for us as staff people to go out there and make those connections with people sometimes and be the face of our collegiate recovery programs, because we want to grow it because we believe in it, but oftentimes students don't feel like they can actually come in unless there's another student that they can see and identify with. So it's not a no, it's a tough balance. It's a really tough thing, the dialectic between holding those two tensions and trying to do it well, you know, because people can just throw students out there and throw a whole bunch of stuff. But I think the passion here is just how do we do it well? And how do we do it in a way that's mindful of the students that we have and understanding the culture, the campus culture in which we operate. And then also understanding the larger culture and community in which our campuses are, you know, reside. So there's a lot of layers to just that one simple piece. Yeah.
Thank you, Keith. Matt, did you want to?
The first thing that came to mind was collaborations. I think, having on campus, having as broad a possible menu of options for people who might be seeking help is really important. And, the traditional sort of like clinical model is just a turnoff for a lot of people. And so having a lot of different sort of entryways to help seeking, wellness, whatever it is you want to call it, I think is really important for the broader sort of university community, whether it's wellness coaching or, mindfulness groups or whatever. And so, so just advocating for that kind of stuff, partnering, referring, I get more calls from students who don't really want to be in the collegiate recovery program than I do from students who do. And I end up steering them towards different resources, both on and off campus. And so, so just like whatever you can do to help broaden the continuum or the spectrum of services on campus, I think is really important.
Yeah, and I can add to that. I think in terms of destigmatizing and normalizing, I think we need to be really active participants. And when I say that, it doesn't mean we have to be out, especially right now. But like, I know in our counseling center, we have an area dedicated to recovery support services. So our students see that recovery is something we talk about, but simultaneously in our recovery spaces, we talk about mental health. We refer to our counseling center. The students know that they can reach out to Kristine, that Kristine is a safe person to speak to. If they don't feel safe talking to anyone else, there's at least one person in the counseling center they know they can connect with who will be there and listening. And then we also, as a counseling center, do outreach events related to recovery. So like, I think it was in Houston, I heard another school talk about an event they did, Let's Talk About Recovery, which we totally stole at MSU. I don't know whose brilliant idea that was, but the double entendre of talking about recovery and eating tacos, I mean, does it get any better than that? And so it was hosted, collaboratively between the counseling center and our recovery program. And so again, it's making it accessible. And we all know that, of course, during COVID, it's a little harder. We're not having opportunities to sit down and eat tacos with people. But doing those events when we are in person is profoundly helpful. The other thing we do is we constantly publish on our campus in our wellness newsletter on campus that goes out like twice a week. And so really talking about the recovery supports as well as the mental health supports and the overlap between them. We have groups called Let's Talk. We have a drop-in services like Let's Talk. We have Recovery Room, which is also a drop-in experience. And so really letting students know that mental health is something we need to be talking about, as even if you don't have any diagnosed mental health issues, we're humans. We're going to feel sad. We're going to feel anxious, and particularly during these times, and really normalizing that as a part of the human experience and not making it this scary thing. And so when we make it a normal part of discourse on our campuses, it helps not only our students in recovery, but the entire campus reduce that stigma.
Thank you.
Oh wait, may I add one more thing? Because I just thought of it as people were sharing, and I just really realized it too. Parents, parents are super instrumental, or significant others or loved ones of students are super instrumental in making sure that schools provide services. And with that, also a big time donor helps raise mental health stuff on campus too, because oftentimes, again, there's always that intersection between mental health and substance use. They may not want to explicitly help substance use students that are in recovery from substance use disorders, but they'll definitely be like, oh, can I help with the students that are struggling with other mental health concerns because my child or my loved one went through X, Y, and Z. And then boom, that causes the administration to take a look at what's going on, and dollars talk over a lot of stuff. So let me just throw that out there.
Especially during COVID, Keith, right?
Money talks, the other stuff walks.
Awesome. Does anybody have any closing thoughts? We've not had any questions in the Q&A box, and this is a slightly different style of webinar in that it's just been questions and answers. Do you want to add anything before we close?
You know, I'd like to add, as a mental health provider, I think as the people who are supporting our students in recovery, it's really critical during this time that we also create some space for our own mental health. Whether you're, doesn't matter what kind of position you are on campus, you have a profound responsibility to your students in general, but particularly during COVID, right? And there's so much pressure that I think we need to make sure that we're creating, that balance in our own lives. And I think ARHE has done a great job of providing supports for us during this time, but I think we need to continue to do that and really create space for that self-care. And I'm going to even go a step further, self-preservation, because I feel like self-care is such a kind of a whitewashed term to, it's really doing the things we need to do to preserve our own mental health and well-being, because the demands on the collegiate recovery staff right now are profound, and we're asked to hold so many spaces in so many different ways, and we can't be fully available to take care of our students and provide them the supports they need if we're not doing that for ourselves.
Agreed, Kristine. You can't pour from an empty cup. You have to put your oxygen mask on first. Like, all of the cliches about that is just because they're true. It's so important that we have to take care of ourselves. And we have to find that balance, because a lot of us are juggling different responsibilities, whether that's kids or whether that's taking care of other family members or, living in isolation ourselves. We're all going through our own struggles with this. And it's so important to recognize that. And I agree, like, snaps to that. ARHE has done a phenomenal job with providing us support in multiple ways. And I really appreciate that.
Thanks, everyone. Well, Keith, did you want to add something?
No, I just agree with Kristine. Like, the idea of self-care can slide over into self-indulgence, and then that's nothing that's really productive for a lot of folks. It's just, yeah. So no, I've got nothing to add. How about that?
You have so much to add.
She nailed it. I just wanted to ride her coattails because it was so good.
It was really good. This has been awesome. Thank you so much. Just as a quick reminder, this has been recorded. It will be uploaded to YouTube and the ARHE website. We'll let you know on social media when we do that. We hope that you have found this session useful and that you share it with colleagues. Stay connected with us and learn about future webinars. We're always looking for ways to improve our offerings. A big thanks again to our presenters, and for everyone to take care. Thank you.